Hi, my name is Diana, and I'm going to talk about disorders of fluid and electrolytes and integrate a view of potassium homeostasis. First, we have the definition. The plasma potassium level is normally maintained within narrow limits by multiple mechanisms that collectively make up potassium homeostasis.
So first, aldosterone induces the synthesis of more sodium channels on the apical surface of the distal tubular cells, as well as the collecting duct cells. This allows for more sodium to enter the cells. So more sodium that can be used for the sodium-potassium ATPase, found in the basolateral surface of the tubular cells. The sodium-potassium ATPase is a pump that gets 2 potassium ions inside the cells, and pumps 3 sodium ions outside the cells. As a result, sodium is pumped out of the cells and eventually into the bloodstream, while potassium enters into the cells. Aldosterone also increases the number of sodium-potassium ATPases, and as a result, even more potassium will be pumped into the cell. In this way, the intracellular potassium concentration increases, and this creates a driving force for potassium to be secreted from the cell into the lumen. Additionally, aldosterone also increases the number of potassium channels in the luminal membrane, so even more potassium gets excreted.
Sign up for a free trial today and watch the full video on osmosis.org.
Applications in medicine. The importance of the potassium homeostasis is underscored by the well-recognized finding that patients with hypokalemia or hyperkalemia have an increased rate of death from any cause. In addition, the detriment of potassium homeostasis have been associated with pathophysiologic processes such as progression of cardiac and kidney disease and interstitial fibrosis.
This lesson, we're going to look at the mnemonic 6 L's. So the 6 L's help you to recognize the signs and symptoms of low potassium or hypokalemia. So let's get started. The first one is lethargy. A patient who is lethargic may have low potassium, so we need to take a look into that. The second L is for leg cramps. Patients with low potassium may have leg cramps. The third L is for limp muscles. Anytime we have a patient that has low potassium, they may not have the strength that they normally do. The next L is for low, shallow respirations. Patients with hypokalemia may exhibit this sign. Next are lethal cardiac dysrhythmias, and this one is really important. Anytime we're messing with electrolytes, it can really mess up that electrical current in the heart, and we want to make sure that our patient's not having any problems there. So if they are exhibiting this sign or symptom, make sure you check out their potassium and see if there's anything going on there. And the last L is for lots of urine, meaning polyuria. Anytime a patient is excessively urinating, the potassium can sometimes get lost in that. So make sure that you're monitoring your patient's potassium levels.
Subscribe and click the little bell so you can be notified when our next Nursing Mnemonics video comes out.
Click the little box below for your free cheat sheet.
Then we have the pros and cons. Pros. Resting cellular membrane potential, the propagation of action potentials in neuronal, muscular, and cardiac tissues, along with hormone secretion and actions, the vascular tone, systemic blood pressure control, gastrointestinal motility, acid-base homeostasis, glucose and insulin metabolism, mineralocorticoid action, and fluid and electrolytes balance. Cons. Progression of cardiac and kidney disease and interstitial fibrosis, potential of derailment in the level during the ingestion of a normal meal, and death. Issues applies in Ecuador. In Ecuador, there are clinical guidelines for rapid medical management, which serve as the necessary recourses to treat pathologies related to hydroelectrolytes abnormalities, mainly those related to potassium. Then we have the conclusion. The need for tight regulation of extracellular potassium level is illustrated by the possibility of alteration in this level during ingestion of a normal meal. This disease can affect important organs. The patients need to consult with the specialist for an early diagnostic. Also, much remains to be learned about both reactive and predictive mechanisms of potassium homeostasis and their integration. Thank you.